Inducing lactation. So this is something that I bring up often. It's one of the many conditions or situations that breastfeeding medicine docs can help with. But oftentimes when I say it, people are like, inducing lactation? What is that? And I realize that a lot of people don't realize that it exists, that it's even an option. So let's just talk a little bit about what it is and who may be thinking about doing it. So inducing lactation is simulating the onset, the things that need to happen to start to lactate in somebody who did not just have a baby when that process happens naturally. So that's why it is inducing lactation in somebody who otherwise would not be lactating. And it does require often a lot of work. So that's something to just be aware of. So you're not going to be able to lactate without very, very frequent stimulation of the breasts. And then once milk starts to come, then you also need frequent emptying of the breasts, just as somebody who is naturally lactating would have to do. So it does take a lot of work, and depending on when you think about it and want to start doing it, it has differing rates of efficacy. So one can potentially develop a full supply essentially for their baby's nutrition. But there are a lot of factors that go into that, and some are personal health factors that you may not even know about until you're actually attempting to do this. So it's not something that you can go into really knowing how successful you're going to be, and we as lactation professionals cannot really guess what your chances of success are. Now, that being said, if you have breastfed in the past or lactated in the past, that certainly increases your chances of success, especially if you were able to make a full or close to full production for another baby. So just briefly, a few things that are part of this method. Ideally, if you're considering doing this, you want to start the process actively several months before a baby would arrive. The reason for this is that we want to prime the body and prime the breasts the same way that would be naturally occurring during the third trimester of pregnancy. And we typically will do that with birth control pills because those are providing similar hormones to what your body is naturally secreting during that third trimester. So it starts to develop the breasts. And then we want to simulate birth. So those hormones actually drop precipitously. So then at some point, usually several weeks, again, it depends on how much time you have for the entire process, but anywhere from 6 to 8 weeks up to when you want to start being able to provide milk for a new baby, you're going to stop the pill and then start pumping. So start pumping frequently every 3 hours, along with potentially taking some medications and or herbs that can also help with increasing milk production. So this is a time when, again, you have to put in a lot of work. Now, if you are starting this process later and your baby comes, let's say when you stop the birth control pill, or let's say you didn't get a chance to do any of that priming for whatever reason, then you can actually just start with taking your baby and putting your baby at the breast. And that's actually oftentimes a very nice and lovely way to start your body revving up and making milk. Oftentimes, this needs to be done in conjunction with also pumping, because if somebody else is also nursing or feeding that baby, which they should be, somehow you have to make sure that the baby's getting enough milk, then baby may not be suckling long enough at your breast to do the stimulation that needs to happen. One thing that is often utilized if you have a baby to feed and you want to feed that baby at the breast, but you also want to do the stimulation to bring in your own milk and empty what milk is there, and instead of pumping, there is something called a supplemental nursing system, which is essentially using a feeding tube that goes from a bottle of either your expressed milk or donor human milk or formula. The bottle has a feeding tube coming out of it, and the feeding tube gets taped kind of at the tip of your nipple, taped just so the baby doesn't take it in and swallow it. And then baby nurses, and depending on where that bottle is in terms of gravity, your baby will pull that milk in just as if they are nursing, or they are nursing, but they're pulling milk in addition from this bottle, in addition to whatever it is that you are producing at this point. So this is a nice way to be able to directly nurse your baby, have your baby practice nursing and get used to nursing at the breast, as well as, it may do a better job of the stimulation and the emptying than even a pump does. And there's certain hormones that are released that can also help with the process. So there are a lot of reasons why this can be very nice for both mom and baby, though that being said, it also can be a little bit clunky and difficult to arrange and coordinate. So some people don't like this method because of that. Another thing that I want to stress is that there's a variety of situations that this method could be used for. So if you are adopting a baby, this could be if you are using a surrogate to gestate your baby. This could be used for a same-sex couple who one is carrying the pregnancy and will naturally lactate, but the other also wants to lactate and feed the baby by breast. So both same-sex couples or trans couples that are in a situation where the non-carrying partner can potentially lactate. These are all situations where this can happen. And it's just something to consider. Some people may want to do it and some people may not. Like I said, it is a lot of hard work and there's no guarantee of success. So it really depends on what your goals are and how much time you have, and you may have a plan to do it and then at some point it becomes more work than it seems to be worth it, and that's okay too. So these are just options that are out there. This is not being pushed on anybody. But now you know a little bit about what inducing lactation is and the situations where you might use it, and a little bit of information on how to go about it. There are lactation consultants out there who can help support you through the process. There are some physicians out there who do not specialize in lactation who may be able to help you, but I would really recommend reaching out and finding a breastfeeding and lactation medicine specialist who can help you to not only determine whether or not it is safe for you to do because of your potentially medical conditions, but also can help you not only with support, but also with prescriptions that may need to be written and with other sorts of assistance that may be needed throughout the process. So something just to consider if you are going to be welcoming a baby into your life and family, but are not carrying the baby yourself. Have a wonderful, wonderful day.